This is the Coronavirus Morning Report for Tuesday, March 31st. The death toll surpasses 3,000 in the U.S. and surpasses China's reported total. General Electric workers who normally make jet engines have walked off the job to demand that their factories are converted to make ventilators instead. Did you already have coronavirus some months ago, and could you know it if you did? What actually happens when you get tested for coronavirus? The great debate on if we should all be wearing some sort of mask, and the unique challenges in store when the virus reaches rural America. The U.S. death toll from coronavirus has passed 3,000, which means more people have died from coronavirus in the U.S. than died in the terrorist attacks of September 11th, 2001. At some point today or tomorrow, the U.S. death toll will overtake the official reported death toll in China of 3,005 people, although, again, lots of folks find the Chinese numbers increasingly suspect. The U.S. reported more than 500 deaths in a 24-hour period for the first time yesterday. The confirmed number of infections worldwide continues to grow, nearing 800,000. There are more than 160,000 confirmed U.S. cases, almost double the number announced by China. France has surged past 3,000 deaths. Spain reported a new daily record of 849 deaths and 9,000 new cases. The combined death tolls from France, Italy, and Spain are nearing 20,000. The death toll in New York State has passed 1,200. More than 250 people died in New York in the last 24-hour period, and Governor Cuomo says our peak daily death toll could reach 800 a day. Michigan reported 50 deaths on Monday. Louisiana reached 185 deaths, up from 34 in just a single day. Virginia, Maryland, and the District of Columbia became the latest places to order residents to stay home. The first U.S. service member has died of coronavirus in New Jersey. And quoting from the Washington Post, Defense Secretary Mark Esper has ordered military bases to stop disclosing coronavirus data, officials announced Monday, a lack of information that local officials fear could harm their communities. Individual military bases had previously given daily updates on novel coronavirus cases to the media and the public, including figures such as the number of those who had tested positive or been hospitalized. Starting this week, however, the Pentagon will release only the totals for the department and each branch of the military, Press Secretary Alyssa Farah said in a statement. She cited, quote, a concern for operational security with regard to readiness, end quote. We will continue to do our best to balance transparency in this crisis with operational security, Farah said. General Electric workers who normally make jet engines have walked off the job at their factories to demand that their factories are converted to make ventilators instead. You might have heard that Ford and GE have teamed up to produce ventilators, which is, of course, excellent news. But Ford said in a press release yesterday that it only expects to have 1,500 ventilators ready by the end of April. They believe they can produce 50,000 in 100 days, starting April 20th, and hope to eventually produce 30,000 a month after that. And some raw numbers from here in New York. The city reports that New York City has 20,330 hospital beds and 2,011 ICU beds in terms of total capacity. As of March 29th at 6 p.m., there were 6,635 hospital beds and 1,520 ICU beds occupied. So that means we probably have just a few more days of ICU capacity at current numbers. But to end with good news numbers, according to Johns Hopkins, new cases in Western Europe, excluding Italy, are falling sharply. Link in the show notes to a graph that shows this. New cases in the U.S. are still rising as testing spreads, but so far, the death rate in the U.S. is lower than we've seen in Italy and Spain. But even in Italy, quoting Bloomberg, new infections in the past 24 hours totaled 4,050 compared with 5,217 the previous day, civil protection authorities said Monday at their daily news conference in Rome. This is the lowest increase in Italy since March 17, end quote. And just as we discussed on Saturday's episode, Germany is planning to test and certify presumed immune citizens. Quoting the Telegraph, German researchers plan to introduce coronavirus immunity certificates to facilitate a proper transition into post-lockdown life, as Chancellor Angela Merkel's handling of the crisis has led to a boost in the polls. The antibodies will indicate that the test participants have had the virus, have healed, and are thereby ready to re-enter society and the workforce. The researchers plan to test 100,000 members of the public at a time, issuing documentation to those who have overcome the virus. The researchers will use the information to determine how to properly end the country's lockdown, including reopening schools and allowing mass gatherings, end quote. People have been asking this question online for a while now. Have you already had coronavirus without maybe even knowing it? I know that I have my suspicions about the cold that my kids both had in early February. It had fever, cough, the whole 9 yards. Well, it turns out that it is possible COVID-19 has been circulating for a while now, but maybe don't count on already having gotten it. As we've all become overly familiar with the symptoms of coronavirus, many people are reflecting on colds or respiratory illnesses they had earlier in the year and wondering if it might have been COVID-19, quoting the Huffington Post. There's evidence the coronavirus started spreading in America earlier than people were really tracking it. Some experts suspect that the first U.S. cases began in January. Lee Riley, chair of the Division of Infectious Disease and Vaccinology at the University of California, Berkeley's School of Public Health, told Medium that it's safe to assume the virus has probably been spreading in your community for about 2 weeks before there's a confirmed death. Combine all of those facts, and the theory that some people may have already been infected with the virus and recovered isn't an outrageous one. That may be slightly comforting, especially since some experts believe you have some level of immunity once you get COVID-19, end quote. At this stage, however, there's no way to test if someone had the virus in the past. We can only test people who currently have it. William Hillman, an associate inpatient physician director at Massachusetts General Hospital, said in an interview with The Guardian, quote, "Since there's no real way to know at this point who might have had it, unless you're symptomatic, you get a swab and are definitely diagnosed with it, I would just act as if you hadn't had it. Keep doing all of those things that we should all be doing at this point, social distancing and hand hygiene," end quote. So no matter how much you may think you had it at some point, it's best to continue behaving as if you're not immune and as if you could be a carrier even when you feel well. Did you see that scary image of how far back in your nose they have to stick a swab to test you for coronavirus? It was going around all yesterday on social media. And yeah, it's gross to the point of being horrifying. There's a link in the show notes if you haven't seen what I'm talking about. We've spent a lot of time covering the availability of tests and the development of new testing methods, but with that image making the rounds, it made me want to talk about what actually happens when and if you manage to get a coronavirus test. If you think you have symptoms or have been exposed by someone with coronavirus and need a test, the first step is to call your doctor, who will determine if you meet eligibility to be tested, and if so, will set up an appointment for you to go to a testing center or drive-through site. The test will most likely be a nasopharyngeal swab, which scrapes cells from the back of your nose and the inside of your throat to analyze for signs of the virus. And yes, they really have to get back there. According to Tista Ghosh, an epidemiologist and the medical director at Grand Rounds, it's, quote, probably not the most comfortable thing, end quote, but isn't exactly painful, and it will be over quickly. One problem, according to Gary W. Prokop, chair of the American Society for Clinical Pathology's Commission on Science, Technology, and Policy, is that the nose swabs are starting to run out. So some clinics are using throat swabs instead, which are similar to strep throat tests. They're not as accurate as the nose swabs, but are the next best thing when a nose swab is unavailable. After the swab, you may also be interviewed about your recent travel and activities and possibly asked to self-quarantine until you receive the results of your test. Those results can take anywhere from 1 to 10 days, depending on what lab they're sent to and how stretched thin that lab might be at the moment. If your test is positive, your medical provider will follow up with you to answer any questions you have and discuss next steps. Among those next steps are isolating yourself. If you live with other people, do your best to stay in a separate room. Avoid sharing items like dishware and frequently cleaning common surfaces like light switches, and doorknobs. If at any point your symptoms get substantially worse, especially if you have trouble breathing, go to the ER or urgent care. But if you can, wear a mask when you do so and call ahead so the ER or urgent care center can put protocols in place to limit exposure to the staff and other patients. Another thing that has been making the rounds on social media over the last couple of days has been the increasing debate as to whether or not maybe we should all be wearing face masks. Official guidance from the WHO and the CDC has said that only people with coronavirus symptoms and those caring for them should wear masks. For everyone else, social distancing and frequent hand washing has been deemed to offer the best protection. Some officials, though, are now questioning whether healthy people should wear masks too. Austria, for example, is requiring face masks to enter grocery stores. In lots of Asian countries, wearing face masks in public is similarly required by law in some cases. George Gao, the Director General of the Chinese Center for Disease Control and Prevention, told Science magazine, quote, "The big mistake in the US and Europe, in my opinion, is that people aren't wearing masks. This virus is transmitted by droplets and close contact. Droplets play a very important role. You've got to wear a mask because when you speak, there are always droplets coming out of your mouth. Many people have asymptomatic or pre-symptomatic infections. If they are wearing face masks, it can prevent droplets that carry the virus from escaping and infecting others," end quote. And quoting from Science magazine, "Health authorities in parts of Asia have encouraged all citizens to wear masks in public to prevent the spread of the virus, regardless of whether they have symptoms. And the Czech Republic took the uncommon step last week of making nose and mouth coverings mandatory in public spaces, prompting a grassroots drive to hand-make masks. Even experts who favor masking the masses say their impact on the spread of disease is likely to be modest, however. Many are also afraid to promote mask buying amid dire shortages at hospitals. But as the pandemic wears on, some public health experts think government messages discouraging mask wearing should shift. Quote, "It's really a perfectly good public health intervention that's not used," argues KK Cheng, a public health expert at the University of Birmingham. "It's not to protect yourself, it's to protect people against the droplets coming out of your respiratory tract," end quote. Cheng and others stress that however masks are used, people must practice social distancing and stay at home as much as possible to prevent the spread. When people do venture out and interact, they're likely to spew some saliva. Quote, "I don't want to frighten you, but when people speak and breathe and sing, you don't have to sneeze or cough. These droplets are coming out," he says. Although there is some evidence that COVID-19 can persist in aerosols, which are fine particles that remain suspended in air, aerosol transmission is likely rare, says Arnold Monto, an epidemiologist at the University of Michigan, Ann Arbor. "It's most likely spread by larger droplets," quote, "and we know that standard surgical face masks will have a modest effect on that kind of transmission," he says. "When you combine masks with other approaches, then they may make a difference," end quote. Dr. Neil Fishman, chief medical officer of the Hospital of the University of Pennsylvania, told the New York Times, quote, "For individuals working in certain essential industries where they still have to go out every day, I think wearing a mask makes sense," adding, quote, "If everyone in the community wears a mask, it could decrease transmission. But unfortunately, I think that we don't have enough masks to make that effective policy in the U.S., end quote. So for now, the official guidelines stand. Only those with COVID-19 symptoms and their caregivers should wear masks. But quoting the Washington Post, that may change. Officials at the Centers for Disease Control and Prevention are considering altering the official guidance to encourage people to take measures to cover their faces amid the coronavirus pandemic, the Washington Post has learned. CDC guidance on masks remains under development, according to federal officials who spoke on the condition of anonymity because it is an ongoing matter of internal discussion and nothing has been finalized. The official said the new guidance would make clear that the general public should not use medical masks, including surgical masks and N95 masks that are in desperately short supply and needed by medical health workers. Instead, the recommendation under consideration calls for using do-it-yourself cloth coverings, according to a second official who shared that thinking on a personal Facebook account. It would be a way to help, quote, flatten the curve, the official noted, end quote. Spending more time inside and alone than usual, it's easy to get stuck in anxious thought loops like worst-case scenarios, what-ifs, ruminating about the past or projecting into the future? With social distancing, we need support now more than ever. Talkspace Online Therapy gives you the support you deserve on a schedule that works for you. Talkspace lets you match with a licensed therapist from the safety of your home. Get 24/7 messaging access to your therapist on any device and hear back daily. Talkspace therapists have experience treating a range of issues, including depression, anxiety, substance abuse, trauma, relationship issues, food and eating, and more. Security, safety, and privacy are top priorities at Talkspace. Their platform encrypts and securely stores all client information using the same technology used by the banking industry. We all need to talk through life's challenges. Talkspace offers the support we deserve at a price we can afford. Match with your perfect therapist and get $100 off your first month with promo code BRIEFING. Sign up at Talkspace.com or download the app. Don't forget to use promo code BRIEFING for $100 off your first month. Beachbody On Demand is how you can stay in shape while you're stuck at home. Beachbody is the company behind P90X, Insanity, and the 21-Day Fix. You can get motivated by celebrity super trainers you know, like Tony Horton, Joel Freeman, Jericho McMatthews, and Autumn Calabrese. They have the best programs, hundreds of effective workouts for all fitness levels, ranging from bodybuilding to weight training to cardio hit to yoga and even dance workouts, all streaming to whatever device you want. View on your computer, web-enabled TV, tablet, smartphone, Roku, Apple TV, Chromecast, and more. And again, they don't require any extra equipment. Just some room in your house, a device to stream, say, Morning Meltdown 100 every morning to start your day. Some of the workouts are as short as 10 minutes. In the time it takes you to drive and park at the gym, you could be finished working out. Right now, listeners to this podcast can get a special free trial membership when you text BRIEFING to 303030. You will get free access to this entire platform for free. All the workouts, nutrition information, even support totally free. Again, just text BRIEFING, BRIEFING to 303030. Some good news now about progress on a vaccine. Johnson & Johnson says it has been working on a COVID-19 vaccine since January, and that sufficient progress has been achieved that it could be made available on an emergency basis early next year. In a statement, J&J said, quote, the company expects to initiate human clinical studies of its lead vaccine candidate at the latest by September 2020 and anticipates the first batches of a COVID-19 vaccine could be available for emergency use authorization in early 2021, a substantially accelerated time frame in comparison to the typical vaccine development process, end quote. J&J also announced the expansion of a partnership with BARDA, the Biomedical Advanced Research and Development Authority, which is part of the Department of Health and Human Services. Together, they have committed more than $1 billion to co-fund vaccine research, development, and clinical testing. The company is also ramping up its global manufacturing capabilities for, quote, the rapid production of a vaccine and will enable the supply of more than 1 billion doses of a safe and effective vaccine globally. J&J added that they would make the vaccine available, quote, on a not-for-profit basis for emergency pandemic use, end quote. Johnson & Johnson chairman and CEO Alex Gorsky told CNBC, quote, we have very good early indicators that not only can we depend on this to be a safe vaccine base, but also one that will ultimately be effective based on all the early testing and modeling we've been doing. This is a bit of a moonshot for J&J going forward, but it's one we feel is very, very important for us to be doing at this period in time, end quote. Johnson & Johnson is, of course, not the only company working on a coronavirus vaccine. As regular listeners will know, phase 1 human trials of an RNA-based vaccine by Moderna got underway earlier this month. Finally today, another warning for those in communities that have not been hard hit yet by the coronavirus. While the majority of cases in the U.S. are currently in cities and urban centers, it likely won't stay that way for long, and more rural communities are going to have unique challenges in fighting the virus as its spread accelerates. If you are in a rural area, yes, you have less population density, but that could also mean you have less healthcare resource density than urban or suburban areas, quoting Healthline. Rural areas may be among the hardest hit due to their demographics and lack of resources. The 15% of people in the United States who live in rural areas are largely a higher risk population that is particularly vulnerable to serious outcomes with COVID-19. In addition, many people in rural areas live 30 or more miles away from the nearest hospital, end quote. Additionally, Healthline points out, many rural health systems are already stretched thin and lack a financial safety net from their local or state governments. Tricia Wachtendorf, PhD director of the Disaster Research Center at the University of Delaware, told Healthline, quote, when you start thinking about recovery trajectories and impacts, the extent to which there is community functioning before a disaster has strong implications in that recovery trajectory post-disaster. That goes right down the spectrum. Transportation systems, employment support, hospitals, and public health, food security, all the key systems. If those are low pre-disaster, those are going to have substantial effects on what communities experience during the disaster, as well as their post-disaster recovery, end quote. Former FDA head Scott Gottlieb also noted that it's going to be difficult for upcoming affected cities, rural or urban, to access federal resources since many of those will have been depleted on the cities where the outbreak first hit hard. Quoting Gottlieb on Twitter, the cities that face a growing risk of large epidemics are going to be pressed as many federal resources have been forward deployed to New York and the federal availability to backstop multiple cities is going to be limited, end quote. But Gottlieb says there are certain things communities can be doing right now to get a head start, quote, hope for the best, prepare for the worst. That should be policy in every community. There are many nursing homes across the country that have multiple infections. We'll see a spike in cases and, tragically, deaths over the next few weeks. Some communities have a head start. They must use it. April will be hard everywhere. We'll have multiple epicenters of spread that severely strain our system, but we have the best providers in the world and a resilient system. Many cities had a head start to prepare and implement mitigation. They should use it. Note to Florida, Texas, Louisiana, and others. We have tough months to contend with as epidemic runs its course. Goal everywhere should be to mitigate spread, contain where we can, support providers, preserve life, protect the vulnerable, both financial and medically, and state leaders need to sacrifice what they must to achieve these goals, end quote. As for cities and states that aren't preparing yet because they haven't had many cases, Jeremy Konydijk, who works in pandemic preparedness at the Center for Global Development, says, quote, many areas still think they're not going to be hit hard yet. That's what New York City thought 3 weeks ago when they were still debating whether to close bars and cancel the St. Patrick's Day parade. The people in hospitals now were being infected then, end quote. As I said to my wife when we first started isolating on March 12th, if there was a second Italy, then that meant there was a pattern, and that would be the signal that our family would start isolating. Well, Spain became the next Italy, then France, then New York City, and now Michigan and Louisiana. So there's a clear pattern here, and at this point, I don't see the pattern breaking anytime soon. But note that the pattern existing can actually help you. Look at what New York City is experiencing on any given day, and if your community is not as of yet experiencing something similar, calculate that it probably will be in approximately 2 weeks from today or 3 weeks from today. So you still have time to plan accordingly. The pattern will help you get ahead of the curve and maybe be better off than we were here in New York. The Coronavirus Morning Report is produced by Ride Home Media, producers of the Ride Home network of daily podcasts. Written by myself and James Welsh and Jackson Bird, edited by Jackson Bird. Follow me on Twitter at BrianMCC because on Twitter we like every story we find that we throw into our Slack channel for consideration. So if you follow our likes, you can follow our news collection in real time. As someone said on Twitter last night, today we bid farewell to March, which feels like it began 36 years ago. Talk to you tomorrow.